Hello and welcome to episode 7 of What the Health. This week we're talking about operating rules, which is section 1104. This section deals with the process for creating the operating rules to deal with the electronic transfer of information. That's right, this section doesn't actually lay out the rules, it creates the process for creating the rules. Operating rules are defined in the PPACA as the business rules and guidelines for the electronic transfer of information that aren't already defined. It's a nebulous definition, to be sure, but so is most of this section, so it kind of fits. Electronic transfer of information refers to both electronic fund transfers, such as your copays and insurance reimbursements, and electronic medical records. Here's how the process of creating the operating rules works. First, the Secretary appointed a nonprofit agency called the Council for Affordable and Quality Healthcare's Committee on Operating Rules for Information Exchange, also called the CAQH Core for short. CAQH Core is responsible for creating operating rules that will simplify the financial and administrative transactions, such as EMR transfers and copays. Now, this set of rules has to have 4 subsets of rules, each with different deadlines. You can find out what those subsets are and their deadlines on our blog by clicking the link in the information below. However, the biggest one to talk about is the subset that creates penalties for health plans that are not compliant with the ACA standards. If a health plan is not compliant by April 1st, 2014, they're subject to a fine of $1 per day per covered life until the Secretary determines that they are compliant. Now, covered life doesn't refer to each of the members on the plan. It refers to each of the members and each of the dependents on every plan. On top of this, if the company knowingly falsified their information to the Secretary, those fines are doubled. Now, this fine of $1 per day will increase every year by the same percentage as the total U.S. healthcare expenditures increases. Now, that current rate is about 4.5% per year. These fines are capped at $20 per covered life or $40 per covered life in the cases of fraud, but that doesn't include any interest, late penalties, or administrative fees that the Secretary can assess. Starting on May 1st, 2014, the Secretary will issue a report to the Secretary of the Treasury on which plans are not compliant. Starting August 1st, 2014, those plans will be notified that they are non-compliant. They'll have until November 1st of each year to pay their penalties. These penalties are regarded as a legally enforceable debt to a federal agency, so non-payment is not an option. Getting back to the creation of the rules. After the CAQH Core has established their rules, they pass the list on to the National Committee on Vital and Health Statistics. That committee will review the rules and make a recommendation to the Secretary on if they think the rules should be adopted. If the recommendation is positive, the rules go to public comment for 60 days. After that, the Secretary has an additional 30 days to adopt the rules. From then, it's just a short 25 months until everything goes into effect. The operating rules will be reviewed every 2 years, starting on April 1st, 2014. On July 1st of 2014, the committee will issue their first report on the state of the operating rules. This will be an interesting review, considering that only about half of the rule subsets will actually be in effect by that point. If the committee decides that any of the rules need to be amended, the process is the same as the creation of the rules. CAQH Core will create the rules, the National Committee on Vital and Health Statistics will review them, then it'll go to public comment, and then adoption, and then another 25 months until it becomes effective. Speaking of effective dates, Section 1105, which is the final section of Subtitle B, is a single sentence saying that everything in Subtitle B goes into effect as of August 25th, 2010, unless it's otherwise listed to go into effect in the future. That's it for Subtitle B. Join us next week when we go through Subtitle C in just 1 week. Till then, stay healthy, and we still don't have a better sign-off. Come back anyway.